Welcome again to the Quarantimes. I'm your host Reema Gupta, and my goal through these series of videocasts is to bring you voices of women from different walks of life. With me today, I have Dr. Evita Fernandez. Fernandez Hospital has 5 units in Hyderabad area. Over the years, Dr. Evita Fernandez has converted the maternity hospital into a very reputed institution providing full-fledged OB and gynae care for women of all ages. Thank you, Dr. Evita, for being with me today.
Thank you, Reema, for inviting me. It's a privilege to be able to share our thoughts with you.
Sure. So, as you know, we are in the midst of a pandemic. The two key reasons that are quoted for COVID-19 severity is its virality, which is on average quoted around 2.2, and the mortality rate, which is somewhere around 1% or a little bit higher than 1%. Given that in India, we do have a fair share of other infectious diseases, right? Like TB is one of the biggest cause of death, malaria, cholera, etc. I wanted to get your opinion about how do you compare this coronavirus against our already existing infectious diseases in our environment? Why has coronavirus become such an issue of national importance?
Well, it's a good question, Reema. The reason being, you know, that this virus, the way it spreads so rapidly. Though the mortality is restricted to 20% of the population. And we also know in that 20%, the more vulnerable groups. But the fact remains that it spreads like wildfire. And in a country like ours, with our enormous population, and with a significant group of our population living in conditions where you have it's impossible to create that physical distance, impossible to keep your surfaces clean, virtually impossible where you have no running water and probably enough soap. I mean, the basic things to keep yourself safe or to prevent the spread, we don't have that. So we are fighting a huge force that's we've got a lot of odds stacked against that. Whereas TB, while it does spread, it gives you time, and it's not in that sense, I wouldn't even probably compare it. What is amazing, while these images of the migrant population haunt a lot of us every day, you also see tremendous outpouring of concern, groups everywhere, in different places. I mean, neighborhood, people are coming out to help, people are forming chains of support. So, because in a country like ours, the government alone will not be able to feed the hungry. And I think in one sense, this whole thing has touched the lives of everybody. And, so the downside is, while we have all these challenges, the upside is to see this tremendous outpouring of concern and, working together. Yeah.
And I totally agree with you. The unity gives us the hope, right? And seeing the humanity, all of us, whether it's individuals, corporates, organizations coming together, I feel that's one beacon of light that says that
yes,
we can go through this, we will overcome it.
Yes.
And maybe to follow up a little bit more is that when you look at the numbers, right, number of infections, at least the numbers that the government is releasing, India somehow seems to be very substantially small numbers given our population versus the other countries, right? And you look at Europe, you look at US, the numbers are mind-boggling. What do you feel could be the reasons that we are seeing such low numbers? Is it because we have taken action early? Is it something, many people have said that because we have immunity to malaria or we have taken similar drugs, maybe that's causing lower infection rate? Or is it just that we are not testing, so there's a lot of unknowns?
I would think, Reema, the more realistic picture is we're not testing enough. So we have no idea of the true incidence of positives in our community. And second, I think quite a few deaths may not be even reported as positive, because you may have people coming in with infection, but if you've not had the chance to test them, I think it's a combination of factors. I'm not sure we have only such few deaths. I doubt those numbers. Not that people are trying to hide it. It's just the fact that it's just not coming into the radar.
Yeah. Thank you for that. My next question is that, of course, you and your staff are on the front lines, and I think I really appreciate that information. It has just made us aware how important our healthcare professionals are. You run this group of hospitals. Tell us a little bit about the precautions that you and your team are taking to ensure your safety, because that's the first thing, right? If our first is not safe, we cannot expect the next people to be safe. And again, we are constantly hearing about shortages of personal protective equipment and test kits from media. What has your experience been?
Yeah. Well, way back, I mean, we go back to long before the 22nd of March when we began to read about things happening. We got into the whole mode of setting up processes and training and preparing for it. And we were very, very clear that our staff would require personal protective equipment. And we focused on that. In fact, we had also decided if any unit doesn't have PPE, we would have to shut down the hospital. We were not prepared to expose our healthcare workers to such risks. And so we began to start looking at it. Even the home team looked at innovative ways of making visors so you could protect your staff. Security guards, nurses in the screening room, isolation room. So we ended up making 1,000 visors, getting ideas from LV Prasad Eye Institute, going on to YouTube, testing, making masks to protect people, at least when they go out on the streets, but making sure we had enough surgical masks for all healthcare workers, starting with the lady security guard who screens every visitor. Now we're also making cloth masks to give a patient and attendant who's asymptomatic, but at least some protection. So I do believe that an organization has a moral responsibility to its employees. So just procuring equipment is only 25%. The main thing is training. So we've been spending hours and days training in different languages, made videos at home, in-house. I'm blessed to have an amazing group of professionals, photography, video, obstetricians, anesthetists. They've all come together, and one particular colleague has had an amazing capacity to do extensive reading because she happened to be on a sabbatical. And so that gave her, the time to do all the groundwork and put these protocols together, and all of us plugged in on Zoom 3-4 times a day. So now we run these sessions for the rest of the country every night at 9 o'clock. Dr. Lusat takes a session, and 150 doctors from across the country can plug in. So we're sharing, this is what we put in, this is what you need, these are the lessons we've learned, be careful, do this, do that. And it's been an amazing experience and a tremendous privilege to be able to share this kind of stuff across with other colleagues. Yeah.
I think this is great. This is the kind of forward thinking we need. It's like, you're anyway doing this work for your own staff and doing this research, and to be able to share it with a much larger community and get them up to speed on some of the best practices, I think it's phenomenal. Appreciate
we need to do that, Rima. We have to. We're all in this together. We are now a large family across India. And just like we're learning from somebody else, we just need to pass it on and customize it for Indian situations, because there are a lot of my colleagues running hospitals under tremendous constraint. I mean, we are lucky, we are large enough to have an infrastructure, but there are a lot of my colleagues working alone in the districts, offering service with no protection, with no team to support them. And they really are heroes out there. So we need to at least support them with, the knowledge and whatever practical inputs we can offer them.
Sure. So from a protective, equipment perspective, you mentioned you had masks and you procured a lot of them. So right now, it seems like you are sufficiently equipped to be able to continue.
At the moment, to at least hopefully let it run for a month, hopefully, if we don't get flooded, because we are getting requests from women and other hospitals. So that's also been another difficult decision. We felt we had to first stand by our mothers who are booked with us. But we're also getting requests from mothers who now their obstetricians are no longer able to give them the care that they need. So where do they go? So each hospital now does a quick look and say, okay, do we have beds? So if we have beds, then we take them on. But if we don't have beds, then we just have to say no. And that's a tough one. That's a tough one.
Yeah, and I think that leads to my next question, which is, right, you are of course managing the hospitals, but you're also a professional obstetrician and you work with pregnant women. And so maybe if you could talk a little bit about what are the challenges that pregnant women are facing in these times? Has there been a change? You mentioned anxiety might be an issue. The other thing is, do you think pregnant women are more susceptible to coronavirus infections, and should they take specific different precautions? And in terms of just the positive rate of testing, are you seeing more cases in pregnant women? What are the trends you're seeing from the customer?
To begin with, Rima, based on whatever research and evidence that's come out from China and Italy, and now slowly coming out from the US, there's no hard evidence to say that pregnant women are more susceptible. There's nothing written in stone as yet. But certainly, we would take precautions and advise women to stay home if they are otherwise healthy and they don't need to come to the hospital for routine checks. Yes, there are the odd reports of a baby having the infection, but they seem to think it's more connected with the community rather than vertical, from the mother to the baby. But having said that, we're not treating mothers differently because of the virus. You would give them the same care and take the same precautions, which we call universal precautions. Right now, we have no way of testing. We have no access to testing. So if a mother comes with symptoms of cough, cold, or a history of her husband coming in from abroad or travel, though right now with the lockdown, your travel history is virtually removed. But if she comes from, say, a house where someone has been quarantined, then we go through the whole process of the staff being absolutely well equipped. So when they birth her, or if she's requires a cesarean, then you take precautions. But if a woman is asymptomatic, we pray that she's not positive, because we know about 25% of women can be in the infective stage and have no symptoms. So you still take precautions, but you may not have your staff in the space suit. We're trying to reserve those space suits for women with symptoms where you have a very, very high suspicion of them being positive.
But are there, because the travel has been restricted and women movement, so I'm sure you're advising the women to stay home as much as possible.
Absolutely, absolutely.
And what about, you get a comfort coming to a doctor and having those regular checkups in maternity.
Yes.
And so how are you dealing with the situation?
Well, when we began to start preparing on Saturday, I think it was the 21st of March, as a group, we decided, okay, we shut down all outpatient services and we become only an emergency service. So all three hospitals, we had to shut down ROPs. So Monday morning, we had to call every mother. So from the 23rd of March till yesterday, we've made close to 6,000 calls,
Wow.
reaching out to mothers, telling them not to come, filtering the mothers who we felt had to come. Well, once the lock-in came in on the 25th, then we just said emergencies only.
Oh, really?
And mothers appreciated it because we sensed there was so much anxiety. Because from a mode of where we gave them dates for coming, now we're saying, don't come. So then, how do they deal with this? So there were lots and lots of questions that had to be answered. And I think if anything has happened to pregnant women during this time, it's increased their anxiety levels. And I think it's extremely important to use technology and to reach out to women. We've also now set up a team of psychologists to be available for mothers. In fact, the National Institute of Mental Health, Bangalore, has set up a special helpline, Pan-India, and we've put it on our website of the hospital. So if mothers want to reach out and need help because of anxiety or depression or anything, they can just plug into this website and reach psychologists at their hands. That's very much required. So that's something that we've discovered.
Moving on, my next, I wanted to talk a little bit about different institutions and the role that they're playing. So in India, we have many public institutions of national prominence like the ICMR, CCMB. We also have a very active and growing healthcare services sector. We have a very large pharmaceutical industry, and as you can see by all the nations asking India for hydrochloroquine demand, and we are able to help people out in different countries. But yet, inside India, we seem to lack a coordinated response to this healthcare crisis. Test kits are also not available. And I think individuals are doing some things, but there doesn't seem to be one fully coordinated strategy from a medical perspective, like how you see in US, right? You have coming up, talking about initiatives that the government is taking, how they're working with different institutions. What do you feel is the missing ingredient in India to be able to handle the pandemic? Because they are a national disaster, and we need to have a national coordinated response to it. What do you feel are the gaps, and what can we do to fill those gaps?
To be honest, Rima, if you actually look around, the government is making an amazing effort, because I belong to different groups where I work also with the government.
Sure.
And so I can see the tremendous effort being put in by the government. And so there are many of us working together. So right now, the government is involving private hospitals also into it. Some of the private hospitals are being converted into possible COVID positive centers. The government is also using many NGOs. If you notice, there's a lot of training happening pan-India. Like, let's take the Federation of OBGY, it's called FOXY. And we are about 35,000 strong across the country. Now, FOXY is running webinars for all the OBGY doctors across the country. FOXY is also working with the government and says, okay, how can we work together to help control and look after women and babies? So from my perspective, it isn't as, if I can use the word, uncoordinated. We're actually trying to work together. And we're able to do that. I'm very optimistic about it.
Oh, that's great to hear. And maybe part of it is just the communication, right? A lot of time, like as you said, if you're in the field, you see the ground reality. And I think that's why it's important for us to have this conversation. Those are not part of that loop or circle. Know that, hey, there are these coordinated efforts that are happening. Agencies, and this is what we are seeing the result. And
now, let me assure you, there's a lot of effort being put in. Tremendous, The sad thing where we really fail is in things like running water, clean toilets. Those are, and I hope when all this blows over and policymakers come together, I think if there's anything we need to build up, it's our infrastructure of primary healthcare, and then, go ahead.
I agree. Those are the solid foundation. We need to have a solid foundation before you can build any house over it. And I totally agree. I think it has given, the good thing is that this virus has got us to pause and think and reflect. And as we come out of it, we don't go back to old habits, but we kind of think about what were the gaps, what were the learnings, and how can we have a stronger foundation. And to build on that, one of the things is my dad is a epidemiologist and a community.
Right.
And it was interesting. I was talking to him, and at that time, he was studying, actually his science was considered a side subject, because they said you study, viruses, or you study epidemics post that they have happened, because a lot of data would come only post, the technology was really not there. Versus he's very excited to see all this real time, right, data sharing, covering of data. And a lot of countries have been very proactive in releasing tracking movements and so on and so forth. And it was interesting when I spoke to him about the lockdown and quarantine. He said, Rima, these are, and he's 85 years old, right? And he's saying,
amazing.
What we really need is a surveillance system, a very proactive, predictive system. And so I'd love to hear from you. What are your thoughts? I'm sure you've heard about China has taken it to one level of extreme. South Korea has another strategy with extreme testing and making some of the.
Well, I think, Rima, with technology and the fact that we are virtually on an electronic leash with the government, thanks to Aadhaar, data can be very easily pulled in. Okay. And I think, what your dad is talking about is absolutely necessary, vital for long-term, preparation. Because no more, at least the world, and we, particularly in India with our population, shouldn't be caught again with another pandemic and totally unprepared. I think with that kind of surveillance, we will be better equipped.
But as a citizen, one of my fears, like when I see this, is the fear of privacy, right? And there's the fear of intrusion, where you don't have a choice. And maybe if you could talk from an ethical perspective, how are some of these, and I know they are difficult questions and we need to brainstorm on it together, but how would a medical community look at it?
I think they're very, very tough decisions, and I'm not sure I have easy answers for that. But one of the sad things that's happening with COVID is the discrimination and the stigmatization that's already coming in with mothers or with people who are positive. Hospitals are not offering them care. Women are afraid to talk about the fact that, or to even give a travel history, or that they are in contact with a person who's been exposed or has been treated for COVID infection, because they are scared that they wouldn't get the care. And I think, to me, these are huge ethical, problems. And the very fact that as a fraternity, we can discriminate and not treat someone with infection hurts here. We go against everything we stand for. And that, to me, is a much bigger problem than the privacy. I'm not sure I see privacy as a huge issue if it's going to cause discrimination.
Yes. So my last question for you is, of course, we talked about it a bit, but I really like this quote by Winston Churchill, right? He said, "Never let a good crisis go to waste." And I'm not sure whether pandemic is a good crisis or not, but it does present a good opportunity for us to introspect. And I'd love to hear from you. We had talked a little bit about, what is the responsibility as we introspect? What do you feel as individual citizens we should think about the responsibility of us as individual citizens to the country and to make sure to the public health? And second thing is for professionals working in the healthcare sector, how can we strengthen our institutions? How do we take this conversation forward?
I think, Rima, this pandemic has been a great leveler. Whether you're rich, poor, developed, or developing countries, it's brought us all to our knees, and I think even the lockdown has had its effect. Everybody, I'm convinced, our lives will never be the same. We are changed forever. I'm very optimistic. I think majority of us, the pendulum could swing both ways. You could come out of this and say, I will never want to be poor again, and be absolutely chasing to build up your resources. Or you could say, hey, a lot of things don't matter anymore. And you start looking at, I think majority of us got in touch with our humanity and our own mortality. And I'm hoping that with this, the new world that comes out, we will be more compassionate, kinder, and more generous. And I think if we, at least people who are involved in policy, public health, medical fraternity, come together to start building, as Bill Gates had mentioned in 2015, to start building the infrastructure so this doesn't happen again. And that can come only when we put aside our differences and work as one big family. And I think India will do it. We are very resilient. And if anything has emerged out of this whole thing is that need for social connection, the need for love, and the need for human touch. Ultimately, it's love and human relationships that matter. And I think that's going to be the great motivating factor that's going to put us back on track. We can never go back to the way we lived our lives. I'm absolutely confident about that.
I love the positive note that I hope it changes us for the better. I definitely feel we are a lot more aware of our environment. The pictures, because the impact the lockdown has had on reducing levels, on our consumption patterns, on how we live, our hygiene.
Yes.
I think it has given us a lot to think, and it is in the positive direction. Let's hope we build on this and leverage this as a diving board, right? To build new policies, new infrastructure, and to create a better world for all of us.
Yes, absolutely. Yes.
Thank you so much for joining us.
Not at all. It's been a pleasure and a privilege, Rima.